everybody. Welcome to Confident Care Academy. My name is Anna.
My name's Chrissy.
And we're co-hosts on YouTube and on a podcast, Spotify, for people who are new to critical care, people who are in nursing school, students, SRNAs, all of that good stuff. Today we're talking about new graduate or new to critical care anxiety and how it can be good and ways that it can be really bad. So we're excited about diving into it.
Yeah, I definitely want to start out by saying, first and foremost, if you're feeling anxious, it is so normal. Please do not stress out about it. Please don't stress about being stressed. No, really, don't think that you're abnormal. Don't think you're different than anyone else. Every single person who walks into the ICU for the first time, whether you're a med student, an intern, a new grad nurse, a nursing student, it is a terrifying place to be.
It's a lot.
The stakes are high and people are rough.
And it's loud and very overly stimulating. So if you weren't in critical care in nursing school, you walk into the ICU for the first time, you got 47 monitors that are beeping, the people are a little bit intense, and it's a rough environment. And I think one of the things that we're kind of going to dive into later is feeling isolated in the ICU is one of the most anxiety producing things, and realizing that you're not alone, even that you may feel like you're alone. That being said, everybody's anxious when they start off. People might put on a front and then they're tough guy. I've never been nervous. Everybody is nervous starting off in the ICU.
For sure.
And that's totally normal. And it's how do you use those feelings of feeling nervous to be a good patient advocate and not just an anxious ball of stress who crumbles and falls apart. So that's what we're gonna dive into.
Yeah, I can tell that. And you'll notice you'll probably hear preceptors, educators at some point say oh, I'm worried about the new grads who aren't nervous. If you're, pretending that you're not nervous, pretending that you're not afraid, or if you truly don't feel a little bit afraid, I think we need to have a conversation here because the stakes are truly high. Patients, can get hurt really easily. You need to be very vigilant, very thorough, on top of your game, and have humility and a willingness to ask questions and investigate so you can keep the patient safe. Anytime that you're assuming, you are putting someone's life at risk. So we need to have a little bit of anxiety to
healthy respect of the situation.
Healthy respect, yeah.
I think another term you'll hear a lot is oh, well, they're a cowboy. In the ICU, you don't want to be a cowboy. That means that you're going with no knowledge, no rules, and you're just kind of following the vibe, but the vibe is not based off of knowledge. So you'll hear that the new grads who get relocated or don't make it out of the critical care program, it's usually because somebody's not asking questions and not really having that healthy knowledge of what's going on at baseline. So you don't want to be just a cowboy going off doing their own thing. You want to be somebody who is aware of the situation, using your words to communicate. It's okay to be anxious. It's not okay to just take matters into your own hands and start doing medicine the way that you think it should be done for a critical care patient, especially when you don't know what you're doing. So, and that really circles back to just awareness of your environment and communication with the team. Yeah. So what would you say? So how as a new grad do you have awareness? What would you say in a new grad that you're precepting, or even an SRNA because you're a CRNA, how would you say that somebody they have good situational awareness?
Okay, so this is probably, I guess there's a couple factors here.
Yeah.
So when you're brand new to an environment, first day walking into an OR, first day walking into an ICU, right? There is a lot of equipment and sounds and things that you've never seen before.
Loud. Yeah.
What the F is that? And you're looking at devices and machines and everything looks like a foreign language to you.
Yeah.
Especially if you're anxious, it can take a minute for you to stop and slow down and read. I always joke about in codes, I open up the code box, or the drawer, or at least when I was younger, not anymore, but used to open up the code cart and then everything is in Mandarin and you're how do I, which one's the,
you don't know
you can't read, it looks like it's scrambled to you. So, getting your brain to slow down and stop and take a deep breath and actually read the things and look at what you're looking at. You're going to look at a monitor, you're going to see a ton of vital signs on it. It's going to be overwhelming. Go line by line.
Yeah.
Just slow down, take a deep breath, and go line by line. EKG. That's the heart rate. Okay, it's a sinus rhythm.
Pressure.
There's P waves, right? Yeah. That's okay, blood pressure. Okay, why are there two blood pressures? I don't know, but I'll ask my preceptor and we'll circle back to that. That, you just want to go line by line. What's that machine? I don't know yet. I'm going to write it down. We're going to ask. We're going to go back to it. Just one thing at a time. Do everything in a systematic way And the same way every time. Just like slow yourself down, take a deep breath, and look at what's actually in front of you.
Yeah.
One thing at a time.
And look at the patient, because new nurses look at the numbers and they don't look at the patient, and then you'll be like, oh, well, you'll walk by the vital signs and you'll see the signs on the monitor, and then like your patient's like not breathing, and you're like, oh, like always look at the patient. But then this kind of reminds me of like you have to walk before you can run. Like if you're a new grad, it's your first month, they're not going to expect you to be able to like set up to line, intubate, and float a swan by yourself. Like that is not the expectation. The expectation is that you really be working on your communication so that you can tell your preceptor what you don't know and ask so that you can be told what's happening. If you're still a student, if you're still a nursing student and you're working as a CNA, I would really, really recommend to kind of start to get that, which I don't have in the OR because I've never like been in the OR as a student. But if you're a nursing student and you're working as a CNA and you have emergency situations, take a step back. Be the person who's standing at the door and like absorbing everything that is happening in the room to really kind of get a feel of what is happening and what the flow of things are. Because I think that if you can kind of sit there and absorb like what is happening in an emergency situation and then you become the runner after that, I think being a runner is a really good job for a tech or a student, because then you start to think, what's the next thing that's going to happen? So as soon as you see like, okay, well, we're intubating this guy, or he's in respiratory distress, I think we're going to intubate. Okay, what am I going to grab for that? I'm going to grab the
airway box.
I'm going to grab the airway box. I'm going to pull the bed out from the wall. I'm going to make sure we've got suction. So then you start to think like 4 steps ahead of where you are. But again, like if it's your first day in the ICU and you don't know how to read like the monitor, like go through and ask questions.
Yeah. Like let's like back to square one.
Yeah.
Like pick a system and stick with it, right? So like you're going to walk in the room and you're going to first look at the patient before you look at the monitor, and you're going to do like a mini assessment, right?
Mm-hmm.
Your head to toe assessment you're going to circle back to, but you're going to look at the patient. Are they breathing? Yes or no? Is everything connected that's supposed to be connected? Yes or no? You're going to pull back the blanket. Is there a hemorrhage? Is there a giant GI bleed? No. Okay. Like, just like a quick once over. Then you're going to look at your monitor.
Mm-hmm.
What's my heart rate? What's my blood pressure? Are they oxygenating? Okay. Then you're going to look at your drips. What's running? Is it connected? Is it running into the pillow or the patient? Does the patient have access? Okay. And you're just going to take a deep breath and just go through it in a checklist manner. I really, really, really recommend all new grads. All
structure is really good for new grads.
Yeah. I would recommend every provider, every new grad, every person on the planet in healthcare to read the book, The Checklist Manifesto by Atul Gawande.
Is that the airplanes one? Where like
the airplanes one.
Okay. Yeah.
Yeah. So basically the idea is that the airline industry has completely standardized safety by using like checklists, right? Yeah. And like checklists make us more efficient and it makes us better providers. And a lot of people think they're too good for checklists. I don't need them. But the truth is it makes you better faster. Mm-hmm. And by shaving off time and making yourself more efficient, like you're more thorough, you're less likely to miss things. And then you have more time to dig into the knowledge later. Yeah. So as a new grad, have checklists and formulate them with your preceptor.
And this, we're going to get into report in our membership. So join the new to ICU membership. We're excited about that. Report is in August, and then in report is your plan for the day and your checklist for things that you're doing for yourself. Completely agree with structure. And I also really like how you're talking about like, okay, take a beat, take a minute and this is a really common thing like throughout my orientation experience. Sometimes you get so flustered and overwhelmed in the moment of like, things are beeping at you, your patient's hypotensive, they're bleeding out, your preceptor is like kind of yelling, not really yelling, like they're raising their voice, and it's like a lot. So like in those moments, if you get so in your head and the anxiety starts to take over and you start to feel yourself like having a panic attack, like that is when really you just got to have that mind-body connection, and like it's okay to take a couple of breaths and then to circle to what is the most important thing next. Because when you're a new grad, you have a hard time differentiating what's important and what's not important.
That's true.
You're that takes time. And then so you get really caught up in task management as a new grad, like, oh, I have to brush their teeth, I need to change out their linens and clean up the room, and it's like, okay, well their hemoglobin's 4.8, you should probably send a lab first. So it's hard sometimes for new grads to differentiate like what's the most important thing to do when. Yeah. And the first thing is like you have to have that mind-body connection to not be having a panic attack in the moment, and then you just need to think, okay, what's the next thing that I need to do, and why is that more important than the other 40 things that I have to do?
It's true. That's really true. I guess like the issue is that there's a big confusion between urgency and importance. And another really great article that you can look up, I mean, I'm hoping you can access it online, it's called Tyranny of the Urgent. And it's mostly about like what you do in your own life or like your school life, but I think it applies to work as well. A lot of times it's very easy for us to confuse what is urgent and what is important and then get overwhelmed in the sea of tasks, like you're saying. And especially if something's been reinforced in your head by a preceptor or like when you're giving a report, like maybe somebody's gotten on your case for not finishing something or getting to a certain task, you might confuse urgent tasks with important tasks. So knowing like what's time sensitive and like what's like and how to prioritize and time manage is going to come like over your first year of working as a nurse. You have to be patient with yourself. But just knowing like that, going back to the ABCs, airway, breathing, circulation, like go to square one.
Yep.
What is going to kill my patient
fastest?
So, that's the rule.
And that's what's important. And things can be that great example. Your patient kind of headed towards respiratory failure.
Right.
3 family members are on the phone. And they're annoyed and they're calling frequently.
What's urgent?
What's urgent and what's important? It sounds like it's urgent to talk to the family. It's more important that your patient has an airway.
Right.
And
the family's urgent, the patient's important.
Yeah. Right. And like communication is important with that too, of course. But it is like, you know what? The family at the end of the day would rather their family member have an airway and be breathing versus me talking to them.
Right.
So like, and then that is hard as a new grad because you have to learn how to like, people aren't necessarily going to tell you, oh, it's okay to hang up the phone on the family. Like people aren't really going to necessarily like help you differentiate what's urgent and what's important, and you have to kind of make that determination of like, hey, it's more important that I make sure that my patient is like clinically stable before I can talk to family.
I would say this is a conversation that we're going to get into more in our communication episode, but you know, that's a really important point you made and a really good skill to have is learning how to address like learning how to cut people off in a polite way so that you can get to the important tasks. So let's say you're on the phone with a family member or a provider or like talking to someone and they're just like not like coming up for air, giving you like a pause to like naturally end the conversation and you do have to get to something. Learning how to be firm but polite and to say, I'm so sorry to interrupt you. Something urgent has come up. I will call you back as soon as my time is free. Just to, like, you know, the patient is stable. Like just letting them people know, like, you know, your mom is stable right now. I'm so sorry I have to cut you off. I do have something urgent I need to get to. I will call you back later and make sure that you actually follow up on it. You want to keep your word or delegate that test to someone else if you can. Or
even sometimes with COVID, it has gotten like so busy, like sometimes you literally don't even have time to call them back. And I would say something in that instance, like, I am taking really good care of your mom. She is stable, but I have to go take care of a couple of things. You can try to call back later. I don't know if I'm gonna have time. So, but then like that's honest. But always give the assurance that it's like your mom's not dead. But it's like I gotta go, which is. Again, like, we'll get into communication and a lot of stuff like that later. Getting into, I can think of, as a new grad, I was a very anxious new grad and flip-flopping from day shift to night shift and really critical patients and big personalities, as you'll hear it in the ICU, which just means that people are super abrasive for no reason. So, like, I grew up in the South and then I started as a new grad in Baltimore. And so there was a lot of kind of like, very direct and to the point communication that I wasn't really used to. So that was like a big culture adjustment for me. But I'm grateful for it because I think it made me a stronger nurse, but it was a lot at the time. So there were times that for me, anxiety and taking care of my physical needs were like a direct one-on-one correlation. And now I'm in a place where like I'm in CRNA school, I'm sleeping during the night, I'm working out, I'm eating food. I'm really not that anxious right now. When I was a new grad, I was sleeping maybe 3 to 4 hours in between night shifts. I had a long commute. I was eating foods that like sounded good to me at the time because I was like nauseous because I was anxious, and then I wasn't sleeping. So it's kind of this self-repeating cycle. And then you're not eating foods that are super nutritious because you're not hungry because you're nauseous because you're working night shifts. And then you're having like 300, 400 milligrams of caffeine and then your like hands are shaking. And then it's like, you know what? You're not taking care of your literal physical needs.
Yeah.
You're not sleeping. You're not drinking enough water. You have a lot of caffeine and you ate a lot of salt. None of that is like really helpful. So as much as it sounds like so simple, like try to meet the basic requirements of like feeding and nurturing another human being for yourself. Yeah. So like pack snacks, try to make sure that you're sleeping, because my anxiety, it got in this negative feedback loop of like, I was so anxious because I wasn't sleeping, and I wasn't sleeping so I was anxious, and I had coffee and I was really stressed out, and then like it comes out, right? Like then you end up crying in a supply closet at 2 a.m. at work, and like I've been there multiple times.
All right, I will say this too.
Yeah.
Sometimes it's really easy for us to preach like, oh, make sure you get your sleep. But when you're anxious, it can be hard to sleep, right? Like chicken or the egg issue, and then your lack of sleep makes your anxiety worse.
And then you lie there and you're like, oh my gosh, I haven't slept enough.
Right, because you're replaying the shift in your head. So I have two like really great things that I have used in the past. I don't really use them consistently anymore. I don't need them, but I have found both to be very helpful at different times in my life. One is, oh my God, I'm blanking on, what's the mindfulness app's name?
Calm?
Okay, that was the other one I was going to say. So let's start with Calm. Calm is great.
Yeah.
You do have to pay for it, but you can
Your hospital might help you pay for it. I don't know.
Sometimes wellness programs include stuff like that, but that's besides the point. It's not that expensive. You can afford it. You're a nurse. So the Calm app, they have like these guided like meditations you could listen to that help you fall asleep, and it can kind of just help like drown out the noise in your own head to help you drift off. The other one was this mindfulness app that literally teaches you the skill of mindfulness. What is it called?
We'll circle back to it because I have something with this and I think you'll remember it. For me, I thought that I had a very like negative mindset approach as a new grad. I was like, everybody hates me. This doctor hates me. I did that wrong. Blah, 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 blah. And then like you get to the point where you're ruminating on something. You're playing it over and over in your head. You're worried about what that one charge nurse thought because you fumbled the charge report or whatever. You stumbled over your words, so I was replaying it in my mind. So that is not productive. There's nothing about that is making me take better care of the patient. There's nothing about that fixes the past or helps me in the future. So the one thing that I did that like really, really helped was like if I was laying there and I couldn't stop replaying what I did, I would get up and I would write it down. Yeah. And then my logical brain could look at that and be like, oh, the charge nurse doesn't hate you because you forgot how to pronounce levofed. Like that is ridiculous. But in my mind, I was just like replaying it over and over and over. So when you write it down, you give it this physical forum. And I was kind of resentful of it because like the people at my like wellness program were like, you guys should journal. And I'm like, I don't like you. But it really did help. And it wasn't even as much journaling as much as it was just getting that out of my brain and onto paper. And then I could look at it and realize that like, no, that's not logical. And then I could go to sleep. So that like really helped me when I was like in a negative feedback loop, like spiraling.
Yes, definitely.
Did you remember what it was?
No, I want to.
No.
Okay, I'm gonna pause the recording to like look at it because I'm like, I want you guys to know. So guys,
Chrissy found it.
Yeah, I literally paused our recording to look this up because I'm like, no, I swear I know it. It's called Headspace, and so basically you listen to this like British guy and he's talking to you and he's helping you train your brain in the practice of mindfulness, where you literally learn to quiet your thoughts, which is almost impossible for me to do, for most people to do, I'd say.
Especially as you're like a new grad and you're super anxious.
But you know, the main point of mindfulness is you are, okay, to my understanding, I'm not a mindfulness expert, let's say that, but to my understanding, you are learning to be present in the moment and like aware of your surroundings and physical environment. And doing that, you can kind of like regulate your emotions, regulate your anxiety because you're here. You're not letting your brain swarm in a million directions. So practicing the skill set and like training your brain like a muscle to like quiet your thoughts and just like observe your surroundings can help you learn to harness your anxiety. Yeah. And it's a really good skill to take with you into work as well. So not only for your home life and like learning to quiet your mind at night, but also like in an emergency.
Like teaching gratitude. Oh yeah, in an emergency.
Yeah, like you like literally like learning to just stop and like as soon as you feel your body starting to race and your thoughts starting to race, just going, Chrissy, take a deep breath and just what's the first thing? And I do that in every emergency in real life, by the way. I stumbled into that crazy emergency at work the other day.
She ended up intubating in a hallway with like there's like no wall oxygen. It was like a whole thing.
It was like a whole thing. But like I stumbled into this like crazy emergency and it was a chaotic scene and I was the only person there who could do anything about it. Yeah. So, and I had no resources and no help. So, just like the first thing I did was I said, Chrissy, take a deep breath. And I went, first thing, get help. And I found someone and I delegated them to get help. And I was like, second thing, airway, okay, let's go.
Airway breathing circulation. Yeah. So I I found as a new grad that I was more afraid. I fixated so much on like the what ifs that was scarier to me than when things actually happened. Like in the moment, it happens. Like, you know, your patient's gonna code, you're gonna do like an open chest at bedside situation, you're gonna master transfuse, and like all of those things in the moment, you're gonna be okay. Like you get through it in those moments, but like fixating at home about all of the what ifs, it is like so draining, and it is also like not productive at all. And then one thing, like I've come a long way in negative self-talk too. And then so it sounds like so cheesy, but when you're a new grad and you're saying all these things to yourself, if you like pause and you're like, would I say this to any of my friends? Or would I would I say this to a new grad that I was training? Like the whole like, you're not smart, you're not good enough, of course you fucked that up. And it's like, okay, well, would I say that to anyone else? Like,
right.
No, I would never say that to anyone else. And we're like so hypercritical of ourselves to a point where it's like, it's not constructive. It's not helpful for us. It's not helpful for the patient. And then like, one thing that is also like super cheesy that I now say to like my students a lot is who are like, it's always like, a lot of times it's women who are like so self-critical because we're taught to be like small and make ourselves smaller, you know? But it's like, I like to tell my students, it's like, take 30% of the confidence of an overconfident dude named Brad.
Yeah.
And like apply that to your life.
Just channel the Brad energy for like just a little bit. Just
so
a smidge.
At the same, like two things can be true, right? So like we don't want an overconfident new grad who doesn't want to ask questions. We also don't want a new grad who is self-combusting, crumbling because they have no self-confidence.
Right.
So like have the self-confidence of a Brad to ask a question, to ask the charge nurse a question, to ask the provider a question. So like, also if you're here, like you're supposed to be here. You're supposed to be where you are. You're supposed to be like taking care of these patients. And there's like no wrong path in nursing because everything you do as a nurse, you're like helping your community and you are like giving back. So like it
coolest
is
part of nursing, honestly.
I love nursing because it's like, okay, well you're working in ICU, cool, you're helping your community. You're working in a school, awesome, you're helping the community of like public schools. Like all of it's awesome. And like if you're here, like don't second guess that you're supposed to be here. You're supposed to be here. You're gonna get through, and you just need to talk to yourself a little bit nicer internally.
Yeah. Like, you know, my two favorite phrases are have a healthy fear, so learning to channel it. Yeah. For me, that looks like personally learning what's in my control and what's not in my control, and focus on the things I can control. So if I'm afraid of hurting my patient, why? Oh, it's because I don't understand this drug. I can control studying that drug.
Yep.
I can control being like really thorough with my assessment by having a checklist. These types of things. What can I not control? I can control if the patient's going to decide to go septic today. Other than having infection precautions and giving my antibiotics on time, that's not in my control. So
like I didn't cause their GI bleed.
Free yourself of the guilt of those things.
Of the what ifs in that way.
What's in your control? Assessing for it, recognizing it,
communicating,
escalating care, communicating when it happens, and asking for help when you're in over your head.
Yep.
So if you focus on those things, again, checklist, studying appropriately, don't study too much at home, okay? You know, schedule a block to study on your off days, but
don't also schedule a walk.
Don't go all day. Yeah.
Go outside.
Schedule time for yourself too.
Good. You need to touch grass, like you really
touch
do.
some grass.
Yeah.
And then, you know, the second like major phrase that like I always remind myself of is be kind to yourself, which is what Anna was touching on earlier. So healthy fear, be kind to yourself. If I could tattoo them on my forehead and like on every single person's forehead that walks into the OR with me, or like I feel like the world would be a better place. It's
so much
just
better.
They're just such good mottos to live by.
Yeah, and the healthy fear thing is like I think that's just having a respect for the like you're taking care of really sick people in the ICU, and like healthy fear just means like you have a respect for like the disease process and like the gravity of the situation, and that you're being there for people like on some of the worst days of their life, and you get to be there. So that's like a healthy like respect of like, hey, I have a healthy fear of the fact that this guy is on CVVH and ECMO and intubated. And you're like, you have a healthy respect that this is like serious, but this circles back to the other thing that we talk about all the time. Nobody expects you at the end of orientation to know everything. The only thing that makes a safe nurse at the end of their ICU orientation is that they know when to ask questions. And they know when to advocate for their patient. So like, you are not expected to know everything at the end of 12 weeks, 14 weeks, 16 weeks, 20 weeks. You're expected to know when you don't know something, to look it up and use your resources and communicate with your team. So your provider and your charge nurses. So like, You don't need to know everything. You need to know, hey, I haven't seen this, or hey, I've only seen this once. Could you come in the room with me as I do this? Like, hey, I did this one time on orientation and I pulled up the policy, but I want a second pair of eyes. That is what makes a safe new grad nurse, is somebody who like has a healthy fear of the fact that like they've never like had to do a like central line exchange for a patient who's on rocket fuel, and then you have to get like a whole separate set of pumps and like change it over and whatever. So like, right, ask for help.
Just ask for help. And you know, like you guys are gonna think I'm crazy. This is the moment where we're all gonna go like, she's lost her mind. She's too far out from nursing school. But the truth is, like, there's a reason why, and this used to frustrate me so much when I was a nursing student and a nurse for years. I finally get it now. I'm sorry, nurse educators, I was wrong. The reason why the NCLEX is the way it is, it's set up to be a safety exam where the focus is you learning how to prioritize and ask for help.
Yeah.
How to be safe. It's teaching you the basic foundation of literally just prioritizing and asking for help. That's the entire point of the test. And that's why nursing school is so frustrating for students. You're learning all the foundational information that you're going to use at work in real life to take care of people, but then all your exams are about prioritizing, and you can't really teach that skill other than getting those questions wrong, like over and over, and learning to train your brain.
And it's hard when it's not paired with clinical experience too, because a lot of nursing school is like didactic, and then you have like now less and less clinical experience, it feels like. So then you're taking these exams, and then you're like, how? I don't know about the like hip flexor fixation for an orthopedic surgery patient. I've never seen an orthopedic surgery patient in my life. So it's like frustrating to take those exam questions. But that is what real life nursing is about, is like, hey, what's the safest thing that I can do here for the patient?
And it's training your brain how to ask those questions in real life. So there is a reason why the NCLEX is not so much a content exam, but a like
application exam.
Yeah, it's like learning how to think like a nurse. And so, you know, I used to really resent it for a long time, but now that I'm so much farther out, I get it. So, you know, taking those basic skills of like your select all that apply and like shuffling things into order, like that's how real life actually works in nursing. You are going to show up in a situation where there's going to be a lot of different things.
You're going to feel anxious. What are the first three you're going to do? And why?
Right. So you're going to stop, you're going to take a deep breath. You're going to say, what's the most important things? You're going to say airway, breathing, circulation, get help. And like, that's it. We're always going to go back to the basics. So that's really, you know, I think the best way to handle anxiety is like deep breath, self-care, mindfulness. And come prepared. That's really it.
And then I think that like freeing yourself of the expectation that you're supposed to know everything as a new grad is huge. Like, you're not supposed to know everything. And then I'm now like a kind of experienced ICU nurse. I've been 3 years and I've been traveling for 2. I don't expect for myself to know every facility policy when I just showed up somewhere for the first time.
That's fair.
And that is completely reasonable because I just got here. You're a new grad, you just got here. Of course you don't know the facility policy on the heparin drip. Just ask.